Angels of Death. In the sterile corridors of hospitals and nursing homes, where trust is sacred and lives hang in the balance, a chilling paradox emerges. Caregivers who kill. Welcome to Angels of Death, a series that delves into the sinister minds of professional caregivers turned serial killers, nurses, doctors, therapists who betray their oath to heal. These are not crimes of passion or profit, but acts shrouded in the guise of compassion. Why do they do it? What drives a healer to wield death as a tool? Is it a thirst for control, a twisted need for attention, or something more lurking beneath their clinical facades? Each episode unravels the eerie psychology of varying figures who perhaps wanted to play the hero, or whose supposed care claimed many lives. What compels them to kill repeatedly, slipping through the cracks of trust and oversight? Do they revel in the power over life and death, or are they driven by a compulsion they simply cannot escape? Through chilling case studies, expert insight, and haunting reenactment, I probe the motive, be it narcissistic validation, psychopathic detachment, a warped sense of mercy, or something else, that transform caregivers into predators. Angels of Death is a descent into the shadows of human nature, where the line between savior and monster blurs. Join me as we ask, how do these killers hide in plain sight? What do they gain from their deadly acts? And why does the system fail to stop them? I will take you through a gripping exploration of the darkest corners of caregiving, where the hand that heals can also kill. Hello, I'm HG Tudor, and welcome to the Angels of Death series. You may be familiar with various famous people that I have placed under the Tudor scope. This follows a similar approach in order to determine what is the psychology behind these individuals who are supposedly caregivers who have killed. But there is a difference. Rather than following the structure of the Tudor scope, whereby it is detailed over many parts lasting some time, I've decided to take a more condensed approach to allow you to enjoy, if that is the right word, this information in a more condensed form, whereby I have gone through and scrutinized the evidence, and rather than take you through each and every piece of evidence in the similar way that I do with the celebrity analyses, I'm going to summarize it and condense it, highlighting the key points linked to the psychology of the individuals, which will make for a more condensed listen for you and enable me to cover far more subjects in a shorter space of time than I ordinarily would do. Accordingly, with that methodology established, which has always been done by looking at a range of different behaviours from a range of different sources over a sustained period of time, let us commence the analysis of an Angel of Death. Beverly Allitt was born on October the 4th, 1968, in Corby Glen, Lincolnshire, in England. She grew up in a seemingly unremarkable family, with little documented evidence of severe abuse or neglect, which would suggest the absence of a lack of control environment, although some reports suggested that she exhibited attention-seeking behaviours from a young age, potentially looking for fuel. Allitt trained as a nurse, but struggled academically and professionally, barely passing her nursing exams. Despite this, she secured a position at Grantham and Kesteven Hospital, where staffing shortages allowed her to work on Ward 4, a paediatric unit, despite her limited qualifications and questionable competence. Between February the 21st and April the 22nd, 1991, Allitt attacked 13 children under her care. Her methods included injecting insulin to induce hypoglycemia or potassium chloride to cause cardiac arrest, leading to the deaths of Liam Taylor, aged 7 months, Timothy Hardwick, aged 11 years, Becky Phillips, aged 2 months, and Claire Peck, aged 15 months. Other victims survived, but suffered severe harm, such as brain damage or prolonged hospitalization. Allitt's crimes were discovered after a pattern of unexplained deaths and collapses prompted an investigation, which revealed discrepancies in insulin levels and her consistent presence during the incidents. In 1993, she was convicted and sentenced to 13 life sentences with a minimum term of 30 years, and was detained at Rampton Secure Hospital, a high-security psychiatric facility. The fact that Allitt, in the position of a caregiver, killed and injured children raises the question of what she is. Convicted of her crimes and having spent a considerable amount of time in prison, what is it that caused this woman to behave the way that she did? Is there existence of narcissism, psychopathy? Might it be something else? For instance, Munchausen syndrome by proxy, which is now caused FDIA. To determine whether Allitt is a narcissist, psychopath, or something else, we're going to look at a range of her behaviors that have taken place over a sustained period of time and evaluate it within the appropriate psychological frameworks. Ordinarily, I would go through various aspects of her life, but as I mentioned earlier, in order to condense this, and so the series can provide you with exposure to a greater number of people, I've decided instead to focus upon the behaviours and explain the evidence behind it. First of all, let us look at the situation about attention-seeking and manipulation. Allitt's crimes were marked by a pattern of inducing medical crises in children, then presenting herself as a concerned caregiver. This is often seen as a common behaviour by a narcissist to create the very problem that the narcissist then comes along to save. It allows the narcissist to assert control, to draw fuel by way of people's thankful reactions, their gratitude, their relief, and may also assist within the management of facade of being a competent caregiver. For example, after injecting insulin to her victims, she would then alert colleagues to their deteriorating condition, positioning herself as a diligent nurse. Survivor families noted her eagerness to remain involved in their care, even attending funerals of deceased victims, where she reportedly sought sympathy and attention. Such behaviour clearly demonstrates an absence of emotional empathy, for to kill a child and then attend their funeral demonstrates a callousness and an absence of emotional empathy to behave in that fashion. She operated with a facade of charm, which was used to manipulate others for personal gain, which is a trait that's associated with antisocial cognition. This particular behaviour certainly allies with a pervasive need for admiration and attention. Her actions support the suggestion that she has grandiose fantasies of being a heroic figure in medical crises, which is consistent with the exaggerated self-importance to be found with the narcissist. Her manipulations, however, were more passive in nature and were aimed more at eliciting praise rather than necessarily dominating others. As you know from my work, it isn't necessary always to dominate, to control, that the provision of praise also suggests that individuals are under control and naturally provides fuel, and therefore is a less overt behaviour and less grandiose, but nevertheless consistent with narcissism. Allitt's manipulative behaviours and superficial charm are core psychopathic traits. Her ability to deceive both colleagues and families point to this. Although she does appear to lack the predatory, goal-directed quality that can be seen with certain psychopaths, where exploitation often serves as material gain. Thus, the accumulation that would ordinarily be present as part of the necessary triad may not have necessarily be seen with her. A common suggestion in relation to cases of this nature involving angels of death is the presence of what was originally named Munchausen syndrome by proxy and is now known as factitious disorder imposed on another. Attention-seeking is certainly a hallmark of FDIA, where the perpetrator will induce illness to gain sympathy from medical professionals or others. Allitt's behaviour fits this pattern, as her crimes placed her at the centre of hospital drama, reinforcing her role as a caregiver. FDIA is often described as driven by a need for external validation, which could be seen with Allitt's actions. What about an absence of empathy and callousness? Allitt's attacks on defenceless infants and children demonstrates a profound lack of empathy, a complete absence of it. Furthermore, she showed absolutely no remorse during her trial, and this was highlighted that she exhibited when discussing her crimes with the police and psychologists, that there was a complete absence of remorse and indeed emotion. For instance, she injected 15-month-old Claire Peck with potassium chloride, leading to her death, and continued her attacks despite the mounting death toll. The fact that she was able to maintain a calm demeanour whilst doing all of this as she harmed individuals suggests considerable emotional detachment. With narcissism, there is an absence of empathy, or what might be described as impaired empathy, where it's cognitive empathy. But nevertheless, narcissists may still experience an emotional reaction to, for instance, criticism or failure. Allitt's clear indifference to her victim's suffering goes beyond the self-centered nature of a narcissist's absence of emotional empathy and suggests a deficit more commensurate with that of a psychopath. Psychopathy includes shallow affect, lack of remorse and callousness, all of which Allitt exhibited in the commission of her crimes and her behaviour thereafter. Her ability to harm children without exhibiting any form of guilt aligns with the emotional coldness associated with psychopathy. There are instances whereby psychopathy also requires thrill-seeking, the stimulation aspect of the necessary triad, or similarly sadistic pleasure, which is also linked to stimulation. But those aspects do not appear to have been documented in the case of Allitt. With regard to factitious disorder imposed on another, the perpetrator might lack empathy for their victims, where the detachment is consistent with FDIA and the focus is on the perpetrator's emotional gratification rather than the victim's welfare. Motives and psychological gratification. Allitt's motives remain debated to this day, but her crimes consistently placed her in the spotlight, something which, of course, a narcissist would relish by virtue of the provision of fuel and a psychopath would find stimulating. She gained attention from colleagues, families, and the media, particularly as suspicion grew. It has been suggested that her offending was driven by underlying abnormalities which have been linked to a need for control, which is present in the prime aims and also in the necessary triad for narcissist and psychopath respectively, and validation, which can also be found in FDIA and narcissism. Unlike serial killers that are driven by sexual or sadistic impulses, Allitt's actions lacked any kind of material or hedonistic goal, which pointed to psychological rather than practical motives. Some aspects of narcissism involve fantasies of unlimited power or importance, and that is clearly the case in relation to Allitt with regard to her desire to control life and death situations. There is no greater sense of power than being the provider of life and the preventer of death, a godlike power. Her need for validation as a competent nurse also, by the presentation of a facade, aligns with her narcissistic need for self-enhancement, and the extreme nature of the crises that she induced demonstrate a certain pathological drive on her part. Psychopaths often commit crimes for personal gain, thrill, or dominance, stimulation and accumulation. Allitt didn't have any material gain. There was no theft, there was no extortion. There's also an absence of documented sadistic pleasure with regard to suggesting it was less about the stimulation. Her crimes were also methodical, but not impulsive, which contrasts with one aspect of psychopathy's lifestyle facet of impulsivity. However, that level of impulsivity can, in certain instances, be controlled by particular psychopaths, and its absence, particularly in relation to one aspect of the commission of behaviour by a psychopath, is not determinative. With regard to FDIA, the crimes allowed her to assume the role of a caring nurse while soliciting sympathy and admiration, and it fulfilled this core need for external validation through medical crises. Nevertheless, as I've explained in a separate video, which was about Munchausen syndrome by proxy, many of the individuals that are described as such are actually demonstrating the behaviour of a narcissist, given the absence of emotional empathy, the sense of entitlement to treat people in that way, the necessity of eliciting sympathy, which is fuel, eliciting admiration, perhaps by seeming concerned about that individual, which also provides fuel, and the utilisation of other people and exploitation of that interpersonal relationship for the gain of power, control, and fuel. What about interpersonal and professional functioning on the part of Allitt? Well, Allitt was described as socially awkward and struggled with professional competence, barely passing her nursing exams. Colleagues noted her odd behaviour, such as exaggerating minor ailments, grandiosity, or seeking attention through fabricated medical issues, fuel. For instance, claiming to have injuries requiring unnecessary treatment. Her interpersonal relationships were also unstable. They were marked by volatility and a need for validation, as seen in her interactions with the various victims' families. This volatility is often seen in the nature of the relationship between narcissist and victim, and furthermore demonstrates the interpersonal exploitation that is undertaken. Narcissism is characterized by troubled relationships owing to the rampant sense of entitlement and exploitation, which exhibits an absence of emotional empathy. Allitt's attention-seeking and volatile interactions align with this. Her social awkwardness fits more with aspects of vulnerability. For instance, her hypersensitivity to criticism, which is a threat to control, as opposed to demonstrating overt and dominant behaviour. With regard to psychopathy, it is the case that psychopaths maintain superficially charming relationships to manipulate others. Allitt's awkwardness and lack of consistent charm contrast with this, suggesting that she perhaps lacked the interpersonal finesse typical of certain psychopaths. Her relationships were certainly dysfunctional, but might not necessarily be regarded as predatory. Psychological history. Allitt exhibited attention-seeking behaviours before her crimes, which included self-harm and fabricating illnesses, which would be linked to drawing fuel and sympathy, which would denote control of the relevant appliance drawn in. It's the case that Allitt's psychological history is somewhat sparse, but reports suggest there was no severe trauma or abuse, though her family dynamics have been poorly documented, so we probably don't have the totality of what has gone on there. Risk factors include a history of medical training, which provides her with the opportunity to use that environment for the purposes of asserting control and drawing fuel and possibly being stimulated by people's responses. There's also a question mark of control as a whole in relation to Allitt, which appears to have arisen with regard to her past behaviours. It's certainly the case that there's no grandiose upbringing for Allitt, but rather that it's more to do with a sense of hypersensitivity concerning threats to control and responding in an aggressive manner when her self-esteem is threatened. There is an absence of documented juvenile delinquency on the part of Allitt or persistent antisocial behaviour, which would also weaken the psychopathy hypothesis. It is, as I've explained in other analyses, that such a history is required for that aspect. Allitt has a clear need for attention. She's manipulative. She used medical crises to gain praise. She has unstable relationships, all of which align with behaviour associated with narcissism. She exhibits grandiosity in being the bringer of saviour. There is a clear need for admiration, which is a requirement of fuel. She clearly has a lack of emotional empathy. She has troubled relationships, which is part of the narcissistic dynamic. Her attention-seeking suggests narcissism of a more vulnerable and covert nature, which has been characterised by hypersensitivity being a threat to control. And it may well have been a case that this has driven her to orchestrate crises for the purposes of bolstering her self-image, allowing her to control people by virtue of the responses, draw fuel from them, and potentially manage a facade as a residual benefit. Her extreme callousness and complete absence of remorse exceed narcissism. Certain narcissists are prone to issue false contrition, but that is not present. Her social awkwardness and lack of overt grandiosity don't suggest a narcissist that behaves in a grandiose way. But, as we know, there are lots of different flavours of narcissist, and therefore, just because her behaviours weren't necessarily grandiose or seeking to dominate doesn't mean that narcissism isn't applicable. Her lack of remorse, her callousness, and her manipulation, the need for control, some degree of stimulation, all accord with psychopathy. Her ability to deceive colleagues and also maintain composure during the commission of her crimes certainly points to the presence of psychopathic traits such as shallow affect and cunning. Psychopathy, however, does require a history of persistent antisocial behaviour, which Allitt lacks. There's no record of juvenile delinquency, impulsivity, or criminal versatility that exists. Her crimes appear to have actually been methodical rather than thrill-driven, and lacked material gain or sadistic pleasure, which are common in psychopathy. Her awkward interpersonal style also contrasts with psychopathy's superficial charm. It's clear that she certainly has psychopathic traits, particularly affective deficits. There is the suggestion also of factitious disorder imposed on another. That's supported by the pattern of inducing illness in children to gain attention and sympathy, which is a hallmark of the disorder. Her medical training, history of factitious behaviours, self-harm and fabricated illnesses, and the need for validation through medical crises would fit with factitious disorder imposed on another. Her crimes, psychological gratification, attention from colleagues, families and media would also align with factitious disorder imposed on another's motive structure. However, it is rare, and it is the case that its diagnostic criteria are less robust than narcissistic personality disorder or psychopathy. I, as I've explained previously, tend to form the view that many of the behaviours of what is now called factitious disorder imposed on another are actually those to be found of narcissism, and I maintain that observation in relation to Beverly Allitt. The fact is that in relation to Beverly Allitt's behaviour is that we see that she exhibits clear narcissism and would meet the various criteria with regard to exhibiting a sense of entitlement, an absence of emotional empathy, a lack of accountability, some grandiosity, possible magical thinking, the presence also of haughty behaviours, a range of manipulative behaviours that were exhibited by her, and also a lack of boundary recognition with various aspects of the narcissistic dynamic. Her psychological profile is best explained by the presence of narcissistic personality disorder with secondary traits of psychopathic features. Her crimes were driven by a pathological need for attention and validation, namely the provision of fuel and the receipt of control, which was achieved through inducing medical crises in vulnerable children. Her attention-seeking, her manipulation and unstable relationships fit with narcissism, characterized by her hypersensitivity to threats to control. However, her narcissism alone can't account for the extreme harm that she exhibited to others, and her absence of any form of remorse and callousness suggests psychopathic affective deficits. Yet, the absence of impulsivity, although not conclusive in itself, criminal versatility, or thrill-seeking, would tend to go against complete psychopathy. There are psychopathic traits, and they are substantial. But ultimately, in conclusion, with regard to the angel of death that is Beverly Allitt, I would conclude that she is a narcissist who has strong psychopathic traits, but doesn't quite get across the threshold to be found to be a psychopath. I'm HG Tudor. Thank you for listening.